ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਤੇ ਤੁਹਾਡੇ ਸਾਰਿਆਂ ਦਾ ਜੀ ਆਇਆਂ ਨੂੰ। ਮੇਰਾ ਨਾਮ ਹੈ ਹਰਲੀਨ ਚੌਹਾਨ ਤੇ ਤੁਸੀਂ ਮੈਨੂੰ ਪਹਿਲਾਂ ਦੇਖਿਆ ਹੋ ਸਕਦਾ ਹੈ, ਪਰ ਅੱਜ ਮੈਂ ਤੁਹਾਡੀ ਮੇਜ਼ਬਾਨ ਹੋਵਾਂਗੀ। ਅੱਜ ਦਾ ਸਾਡਾ ਪ੍ਰੋਗਰਾਮ ਹੈਗਾ ਤੁਹਾਡਾ ਸਿਹਤਮੰਦ ਬੁਢਾਪਾ ਤੇ ਉਸ
and we'll talk about that. So, before going forward, we'd like to acknowledge that our iCON office is situated on the traditional, ancestral, unceded territory of Musqueam, Squamish, and Tesla peoples. I would also like to acknowledge that you are joining us today from many places, near and far, and acknowledge the traditional owners and caretakers of these lands. As I told you, I'm your host, Harleen Chohan. I'm a pharmacist. And let me tell you about digital medication. What does it iCON mean? It means intercultural. We are associated with the University of Digital Emergency Medicine. What is our purpose? To assist multicultural and indigenous citizens, patients, and caregivers, and the community at large about chronic diseases, to help them. And if you're living with somebody who does have chronic diseases, we can help you with that, how to take care of them. We also want to tell you, in the age of internet today, that what you're reading there in news or on YouTube, that all that information, how you should look at it, does it belong to you or not, and you should trust it or not, and what things you should not trust. And last of, we want to tell you that about our healthcare providers, the people who provide you healthcare, and yourself, how to have a good communication between them and how to improve it. And that's example today. And we are here, your caretakers are your speakers today, and you can ask them questions. We will start today with our opening remarks.
Thank you for the opportunity to provide opening remarks at today's Strengthening Health and Wellness as We Age forum. I'm Lindsay Arscott, the Director of Primary Care Quality within the Primary Care Division of the Ministry of Health, and I would like to acknowledge and offer respect and my gratitude to the Lekwungen peoples on whose traditional territory I am located on in Saanich, and to the Songhees, Esquimalt, and Wasanich peoples whose historical relationships with this land continue to this day. The Ministry of Health's Patients as Partners initiative believes that engaging patients and their families, healthcare providers, and community partners in healthcare is not only the right thing to do, but it is an effective way to make the health system better and the people of BC healthier. This philosophy is summarized by our motto, "Nothing about me without me." Patients as Partners has collaborated with and funded iCON for about 15 years with Dr. Kendall Ho as the executive director for all of this time. iCON continues to bring healthcare providers together to speak with people in their first languages about topics they want to learn more about. And today, that is about how we can stay resilient and as healthy as possible as we age. As we age, the risk of being frail increases. However, getting older and frailty are not the same thing. By taking a holistic approach to health, you can stay healthier longer. For example, Cardiac BC states that about 90% of premature heart disease can be prevented with good health practices. Additionally, a recent study by the U.S. Centers for Disease Control and Prevention found that the evidence demonstrates that the strategy of self-management and educating ourselves achieves desired outcomes in multiple chronic disease contexts, including diseases of the cardiovascular system, diabetes, asthma, and arthritis. So there's lots that we can do. I want to thank iCON for bringing us together today, and I invite you to check out the resources after this discussion. You will find information on self-management, eating well, staying active, building resilience, and many other topics. There are websites where you can enroll in self-management, health coaching, and other peer support programs that provide information, skills, and support to help you achieve your health goals. Some of these resources and programs are provided in different languages to make them more accessible. Also remember that encouragement and support from working together as a family and in the community can make it easier to make these health changes. I want to express a big thank you to iCON and our presenters. I appreciate your time. I want to thank everyone for attending. What you do for your health can make a big difference. Thank you. Have a great session.
This was from the Ministry of Health, a couple things. The things that she said that I want to bring into your attention that my health is in my hands. Otherwise, there is no health. So what you can do with your health and to decide to make judgments about your health.
Next is about medication. You can hear from me. My name is Harleen Chohan. I did my Doctor of Medicine degree in 2020 from UBC. After that, I worked with iCON. It's been about 10 years. First, I supported with their projects, and for many years, I'm their speaker. Why I'm here? I'm a specialist in clinical pharmacy, even though I work in Vancouver General Hospital in the transplant department. But what do you think? That you talk about, transplant. Why do I do? And it's really big for me, for chronic diseases. And I saw many patients, especially from our own community, and I noticed that there's so many difficulties that we face when we go to the hospital. Somebody's phone is on. But during these difficulties, I wish to say that we talk to each other. But what is it that it's happening in our community when we go to the hospital? What are the things that we are unable to explain because we are having problems in English, or we don't have any resources, or we are unable to go to our pharmacist or doctor? To discuss all those things, I'm here. So we start. You can tell me more about medication. I'll ask you. Who really likes taking medications? Nobody does. Nobody likes it. How many people are taking more than 5 medications? Or somebody who takes more than 5 medications? If you know somebody, or if you yourself take more than 10 medications, or if you know or take yourself, or if you go to India, you take medication and don't tell your doctors here. Or if you know somebody, or if yourself, say, well, why do we need to take medication? I'll just eat healthy. Or we just, make something at home. We are laughing, yes. Well, how many people, they go to their doctor if the medication is giving them problems? And what can they take with that medication that's giving them a hard time? Now we talk about that. There are a couple of hands in the back. And how many people like homeopathic medicines? There are many. We'll talk about medication. What are we going to talk about it today? What a pharmacist can do for you? Why I'm after you about the medication? What are the things that have side effects? And you can take your medication yourself. What can we do? What is pharmacist roles? There are 2 different types of pharmacists. The one are, you see in your pharmacy, any pharmacy you go to, the pharmacist there, see you. He's going to give you medication. If you have any questions, you can ask them. And if you go there to get injections or vaccination for COVID or flu. And now pharmacist can help you with minor ailments. And you can go to pharmacist to get medication. And if you don't want to, if you cannot go to the doctor and doctor's wait time is too long, and you need your daily medication, your sugar, diabetes, blood pressure, and you can get an emergency refill from your pharmacist. And there are pharmacists in the hospitals, but maybe you don't see them much because they work with the doctors in the background. They review their file and they see what they can do about you and your medication. I'm a pharmacist in a hospital. My mom is in a hospital, but she works in the community you might have seen.
So you tell me, now we talk to each other now. So why should we know what medications we are taking? Yes. When we are talking to the doctor. So we should know doctor gave us a prescription because they know everything about our health. So what we will do if you go to another doctor, because you cannot get appointment with your doctor, or you are going to you are traveling, you are in Alberta or you are somewhere else and you have to see the doctor. So does that doctor will know about your medication? Yes. Yes. The first thing, so you should know about your medication, because if if you have to see a doctor or if you have to go to the hospital, you have to go out of the country, and where your usual regular family doctor, the doc they don't have your family history. So the reason he should know about your medication, because they don't, if you take some wrong medication, if you know about your medication, then you can ask questions about them to your doctor, you can ask questions, or to your pharmacist. So now we will talk about the importance of medication management. Yes. I would like to say that you should officially know about your medication. If you have thyroid, and they will say that the first thing in the morning you should take your thyroid medication, because if you will take it in the evening after taking other medications, you should know about your medications. If you have thyroid, for example, he has given an example. Yeah, so if you take it in the evening, it might not affect anything. So the other reason, let's talk about thyroid. The reason you should know about thyroid, if you are taking, if you think you need calcium and you are taking calcium supplement with it, if there is an interaction, because the thyroid medication will interact with your calcium. That's why you should know about your medication, so that you can tell your doctor, you can tell your tell your pharmacist. They will know how to manage the interaction between the medications. If you are taking it over the counter, how could we can help you? So this is what we are talking about, medication management. Like, then you should we have to ensure that the medications are safe, how if they are not, to avoid drug interaction. So sometimes we go to the pharmacy and they provide you the medication review services. How many people know what medication review is? Only one hand is up. Now two or three. How many people go to the pharmacy? They signed on a white paper where there is the way they have made boxes like for your medications. So medication review is a service from the government that your pharmacy can provide. They can do it every 6 months. the people is for those people who are taking more than 5 prescribed medications. What they do, the pharmacist, they look at the medications and then they will ask, they can ask the question, if you are taking 3 different medications for blood pressure, then they can ask you if your blood pressure is going down, that there is if there is any interaction, and for what illness you are taking this medication. So you can go every year to your pharmacy and you can review your medication with the pharmacist, and at the end they can give you a list what are your medications, what are the changes. And if they got to know like 2 medications, if they know they are not they are not taken together, then they can review it and send a note to your doctor, and they will tell the doctor that they reviewed it and what is the problem, and then they will adjust that medication or they will find a solution for your medication.
As I told you, if there's any problem in your medication review, they can contact your doctor, and it's totally free through BC government. If you have not used that service in the past, you should use it. If nothing else, you'll at least get a list of your medications from the pharmacy. We know the benefits of the medications. If you're taking any vitamins yourself, you can tell your pharmacist about a review. And if you have a list with you, you can tell your doctor. And that can all be captured in one place. It depends. It's a very difficult question. Which vitamins you want to take but you cannot take, you should ask somebody, your pharmacist or your doctor. Some vitamins affect your kidneys, your knees. If your kidney function is low, some vitamins are dangerous for you. It can affect your heart. And some, if you're taking a blood thinner, aspirin, or something like that, and it can make your blood even thinner. So you should ask them what you should take, what you cannot take. With that, what are the risks for taking medication? We talked about how they can interact with each other. Medications are working against each other, and they are affecting one medication to a higher extent or lower. And if you take your blood pressure medication twice a day, some medications are fine, and some are. And if you're taking one more extra pill, it can affect your heart, it can damage your heart. And some people say 1 pill to kill. There's some pills, instead of 1, you take 2, they're very unsafe for you. And if you're taking medication that has expired, those are dangerous for you. And we are not talking about the more medications you take, with time, you need to change some medication. Some medications that are good at 40 or 50, maybe at age of 70 years, it won't work. Because after taking so many pills, you can have risk of fall if you fell. And it's not just breaking bones and stuff, but sometime you can hit your head and you're taking medication. It can make bleeding in your heart, in your brain. And about that, you need to take care of it. And there's so many medications. You can talk to your doctor and ask him again and how they affect your brain, your memory. Where is it? What's your name? And things like that. That's why we do it. And so many times you'll accept this in Canada. In 50%, more than 50% admissions in people with age, it's because of the medication. It happens sometimes. If you have to go to the hospital over and over again, and you should get your medications assessed from the doctor. Fine? As I told you, as we are aging, we're taking more medications. How can we take our medications on time that we don't mess it up? What do we need to take it off? Many people ask me that question. If you're taking more than 5 medications, you have more danger of these things. And very common, that I find, some people say, I'm unable to sleep. I'm unable to sleep these days. Too much stress these days. I can't sleep. My friend told me that if you take Tylenol, it's good. And they're talking about the Tylenol. It has antihistamine and allergy medication in there. It has side effect. Allergy medication, it puts you to sleep. And they say I'm allergic, but I'm taking Tylenol because I need to sleep. But we say that you shouldn't do it. If you have problem sleeping, you should talk to a doctor, consult a doctor, and if you take more and more allergy medication with aging, it can affect you in many ways. It can make your mouth dry, you can feel dizzy, you can fall. If you have something like that, don't do it. That my friend took it, you should go to your doctor. And second is, if you have been taking a medication for a long time, we don't admit it, but long time ago, you felt anxious, and they gave you lorazepam, diazepam, and they gave you some other medications. Those medications, if you take opioids, hydromorphine, or something like that, what will be the problem with it? You cannot stop all of a sudden. You can't say, I know this medication is not good for me, I'm going to quit. Some medications, you need to consult your doctor before quitting those, or pharmacist, because if you stop right away, you can have side effects. It's called withdrawal. Your body is not getting used to it, because you quit. Before stopping any medication, ask your doctor to do it gradually. Many medications you've been taking for years, to stop it, you might need maybe 6 months, 9 months, 12 months, because we need to wean those off gradually. Sometimes we get sick, even if you're not sick, and if you take diabetes medication, if you stop eating, and if you're still taking diabetes medication or insulin, because you stop eating, but you're still taking same insulin, your sugar can go down, and it's very dangerous. It's the same thing. If you take water pill, or there's water in your legs and your doctor said take it, any swelling you have in your legs, that will go away. Same thing. If you got sick, if you're not fine, if you're not eating or drinking well, yeah. And we can take blood thinner, we have already talked about it, and antidepressant and antipsychotic, sometimes we need it because it's affecting your mind. We should talk to our doctor about that, how we need to increase our dose, and please don't stop those yourself.
So, what to do if we have issues with our medications? So, you can talk to your pharmacist. So, how we gonna take care of our medication? You make a list. When you took it, breakfast, lunch, dinner, so you make a list. You keep it with yourself. Like, you can write it on a paper. You can write it in your diary, on your laptop, or on your phone. Some people, what they do, I can take care of myself. They just make they just organize on their own, like they buy organizer Sunday, Monday, Tuesday. On the other hand, you can see there is a blister bubble pack, and inside it it's your pharmacy who manage this blister pack. People who are taking more than 5, more than 7, more than 10, you can use the bubble pack. It's the pharmacy that prepares. It's with pharmacare. Some pharmacies does it free for you. There are new things that's coming in now. We call it automated medication dispenser. What it is a very small machine. You put medications in there, and then it will dispense it for you. So it stores inside your medications, so and it dispense it for you. It's hard to find though, but there are some pharmacies you have to go to different pharmacies. And the other thing is you have to program it. If you have someone in your household, children who can help you, if you all the medications are proper. But the risk is if you are changing your medication, and you cannot reset the system on your own, because if you are changing medication, this is the same thing. This is another example of the same thing. It's by Philips. It come with your medication. You can take it in a cup. But it's for those people who are continuously on the same medication and there is no change in the medication. All right, then there is a daily dispense medication services. The pharmacy comes in, they give you medication every day. Sometimes they provide you a nurse who comes over and give you medication. This is for those people who live alone and who cannot manage their medication on their own. Most of the pharmacies does that, but not all of them. You can ask. And after that, these are the resources, community resources. They are in your package. There are more resources: family caregivers office, pharmacy services in BC. How you can take medications. It's all the instructions are there. This is all from me. I think you got information about the medication. I hope I helped you, and I will answer your questions later on. Okay, we start questions. First one is about bones and joints. Is for Dr. Sohi. Two questions. If your bones start growing, what you should do? The second is if in your joints or in muscles, if there is stress or breakdown, what are the regions and what can we do for that? First of all, we talk about the bone. When the bones are weak, frail, we can see with the test. It's called bone density test. When you do bone density test, if the bone is weak, there is a level. First level, we call it osteopenia. So where we live, there is not enough sunshine. There is a vitamin D deficiency in the community. Where if there is a deficiency calcium, vitamin deficiency, vitamin D deficiency. So the first step is you you should increase calcium and vitamin D to protect your bone. So if they are more really frail, when you reach to the stage of osteoporosis, that means in the bones you can think about they are rotten, they are very frail. Then for that you have to take tablets and other medications that can help the maintain the bone or regenerate the bone. And so you should, if they are going down, bone density test, talk to your doctor. So he will, if you are on the first stage, if they are really weak, vitamin D and calcium is needed. You need a prescription for that, and we can help you with that. Whatever can you do to protect bones? Exercise. That means which exercise? Yeah, so the one that can stress your bone. Walking is good for your heart, for your breathing, but it doesn't do anything to your bones. So the exercise that were shown, and they will show after in the afternoon for your bigger muscles. If you put some load on those big muscles and bones, so that's how you can address the frailty of bones. The second question about the joints. As you age, the the joints, our joints, and it's common. Arthritis is common problem in our joints when we age. It's called osteoarthritis. When it starts, for that arthritis, we can't do much with that. But the joint and the muscles related to that joint, up and down, for example, your knee or your shoulder with arthritis, you have to make your muscles strong, like your shoulder muscle, your arm muscle. You can decrease the pain with, you can lower the pain. You will not need that much medication for that. You can apply creams that lower the inflammation. You can lower the pain with the creams or exercises. Sometimes when the pain is severe in the joint, then we have to replace the joint with the surgery. So in the early stages of that pain, we can refer you earlier when the pain is severe. Then you make a referral. Then waiting list is long. The surgery takes 2 3 years. Then the frailty kick in, because you are not using that joint. So you are not walking that much because the knees hurt or your muscles are weak. Then, so what can we do with the muscles? You asked this question. Exercise, as I told you earlier, and protein in your diet. So these two are the main important things. If you are 70 kilos, if you are 90 kilograms, so the minimum you need is the 70-gram protein in a day. If you are 90 kilo, so more protein you take, your muscle, it will help your muscles. When you exercise, your muscles get a good stress, and with that they are strong, and with age they decrease, and we can stop it from progressing. Next question is unnecessary bone growth. It's the same mechanism like arthritis. When your joints, when there is a breakdown of calcium and calcium deposit in your bone, whatever space there should be, is called grease too, is fluid in the joints. When that fluid is nice and smooth, and then it's the joints are spinning nicely, but when that extra deposit is there, then they are not that smooth, and then it doesn't spin or move nicely smoothly. So to stabilize the joint, those bones, you cannot remove it until there is a surgery, and the muscles around it, you can make them strong, and you can stabilize the joint. So the issues in the joints is usually gradually increase over the years. In the beginning, you are exercising, stabilizing the muscles, that will strengthen your joints. Your question, you want to ask more? Lunchtime, Gurmeet Soi will be around. You can ask her that time. Any personal question you are asking, remember, you can, she's not your healthcare provider. So, so they have a license. Everybody has a professional license. She has a license. You can ask general questions. Don't ask liability questions. So especially some of the things we can't answer. We don't have your history. Please remember that. Your family care provider can tell you most of it because they have the history. We don't. We are not your healthcare providers. Please ask questions, but general questions. There are line of questions. You write your questions. You can write your questions. Please write. There is a line.
1200 milligram calcium in a day that you can take. Some people take calcium pills. It's fine if you're not getting it as part of your diet, but that can create constipation. But otherwise, you can take 1200 milligram calcium vitamin supplements. If you're not aged, but you're still not getting a lot of sunshine, you can take 1000 unit of vitamin D. If you have a kidney disease or knee disease, that your calcium intake is different. If you have kidney disease, it can be different. You can ask your doctor about that. Next question is about social work. You're representative of social work. Both questions are same type. They want to ask if somebody's in your home, they need a placement, they need a care home, and you can't look after them. How to do it? Can you help with that? If you can help, how to contact social worker? There's some information that was provided in the package as well. Bone Health Service line, you can call them in the Fraser Health if you are in the Fraser Health area, and they'll do an assessment, and they'll look at that if your family member is suitable for a nursing home or available for home sport, if that facility is available or sources. And usually they start with that. And if that is not helpful, then they look at a facility, if you qualify for that or not. But it's also that worth looking at if your family member is, if they want to go into a facility or not. Because if their memory is still good and they don't want to go, you can't really force them to go there. As my mom's condition was, she would never go to a nursing home, even in her last days, when she knew in hospital that my health is not well, that perhaps I have to go to nursing home because it will be really hard at home. And then she just lost her courage. Even then, we tried to convince my mom that we are unable to care for you, and you get tired as well, and there are so many responsibilities, but she didn't want to go to a nursing home. Then we couldn't force them. But if mental ability and your memory is losing, and the doctor is saying that this person cannot make her own or his decisions, and you are unable to care for them, then they can decide which care home is better for them. You can talk to your doctor or home health care. Next question is for me. And people who are here on super visa, can they see their pharmacist or prescription? And let me tell you what super visa. There's a clause in your super visa insurance if you know somebody, and read that clause. If you have a BC Care card, and even in a super visa, if you have a BC Care card, those resources are available to you, which are available to BC residents. If you go to see a doctor, there's a fee available that you have to pay. If you need to ask questions from your pharmacist, and if about the medical review, if that's covered or not, perhaps it's not covered if you're not a BC resident. It depends on your care card, and it depends on your MSP. Right. Next question. It's the same. Again for Dr. Sohi. Dr. Leena Zain is not here. Dr. Sohi will help us. 2 questions. First of all, if you can tell again, dementia and Alzheimer, what's the difference? And if you spend more time on the phone, and can you get dementia? First question, if you think dementia is a general category, and dementia has many types, Alzheimer is a type of dementia. If you have Alzheimer, that means you have dementia. And some people might have dementia, but it's not Alzheimer type. It's different. Dr. Jane explained that. If you have stroke and your diabetes, sugar, and blood pressure problems, it affects your brain differently, and it can decrease your thinking or cognitive abilities, vascular, and if you're Parkinson, you can have dementia due to that. There are different types of dementia. Alzheimer is usually short memory, what happened today, yesterday. You start noticing that earlier. When you see geriatrician, you ask them many questions about thinking, about your family, what they saw, and then you do memory tests, and then you can figure out what kind of dementia you have, Alzheimer, or any different kind of dementia. Some people have it mixed. In our community especially, have diabetes problem, heart, stroke. And some people, Alzheimer, vascular, they get the same, that dementia at the same time. And when we see you, we can diagnose that and what to do next. The next question, that's a very important question, that our phones, TV, when you look at it, when you're sitting, you're not actively using your brain. YouTube, WhatsApp, videos you're watching. As you're aging, I'm not saying that it can lead to dementia for you, but it's a risk factor. Because you know 2 things. There are 2 things that can decrease dementia risk, hearing and medical issues. One is exercise. If you do exercise and your brain cells are fine, they remain strong. Other is socializing. People who spend too much time on the phone and they don't pay attention to new interest, and that starts the weakness of the brain. It starts faster. If I can say, exercise is really important, and to learn new things. And if you socialize, see other people, you talk to them, you learn something, and you use that brain in that setting, there's no comparison to that. So use the phone the least amount of time, watch TV the least amount, go for a walk, exercise, spend time with friends, family, kids, and spend more time with them. It's beneficial. Next question. We have only a few questions. I know we have lunch coming up, so we can eat. Next question is, pharmacist. I can answer that quickly. Question is, how you can arrange a meeting with pharmacist. The pharmacy that you go to, you can book an appointment with the pharmacist there. You can talk to them about your medication. And the pharmacy that you usually go to, where you get most of your medications, you can make an appointment there. And I'll be here at lunchtime. You can ask me personally. And if you have allergy with the changing seasons, antihistamine or allergy medication, can you take? Can you take it all the time or as needed? You can do it both. If you have allergies all the time, you can take those allergies medication. But which medication you should take, you should ask your pharmacist. Some medications that can increase your blood pressure, your sugar level, make you sleepy. Which antihistamine you should take, you can ask them what conditions you have and what's the best for you. And if it doesn't help, there are prescription medication available as well. You can get it from your doctor. Yes, you can take it, but just be careful about interaction. Next question, the last question is for Sir. What is Taxi Saver and how you can get it? Especially here in Lower Mainland and in other areas, the service might be different. Taxi Saver program it's through Translate. You have to register. It's called Handy Dart. There's so many coupons available that you can get a taxi at 50% off. There's Handy Dart, that's buses. Then you go to the appointments and they're available for you in the community services. And if you want to go socialize to go make an appointment, and there are tickets available. Taxi Saver program, you can get the coupons from Translate, but you have to register with Handy Dart, and you can use it for 50% rebate at the taxi fare. And Handy Dart has many criteria as well, where you can't use the public system, or you can't walk or sit, or you cannot use the normal public system, and you need that service. It's not available to everybody. And I'll just give a couple more suggestions. Secondly, if we have serious illness and we cannot look after ourselves or the person we are looking after, you are unable to do that, there are many financial benefits available. There's a disability tax credit, and you can get an application through your doctor if you have illness like that. And I just want to give you a suggestion at the end. And right from the beginning, we have so many stressors in life. And now the counseling services are available. And like moving forward, there's a organization available. They give you free counseling or for lower pay. And there are many other services available in the community. I'll encourage you. And, we also need counseling. Sometime in the family, there are so many stressors in life, in our family. And to look after our health and to seek help is also important. Thank you.